How are heart murmurs investigated and treated? A formal cardiac review will consist of a clinical examination and undertaking an echocardiogram or a heart scan to best assess the structure and function of the heart. Confirming normal heart structure and function in context of a murmur is the best way to be sure that a murmur is innocent in nature. No treatment is required as the heart is normal. Reassurance is given to the child and the family. Medical follow-up is not required. An innocent murmur tends to disappear through childhood and adolescence.